Hello, I'm Dr. Amy Patrick. I am a clinical gastroenterologist and have been performing colonoscopies for 20 years. I understand fully that many patients are apprehensive about taking the required colon prep. I am going to provide you with instructions for our prep program and will also give you some tips designed to minimize prep difficulties and maximize the quality of your colon exam. Colonoscopy is not only a powerful tool for diagnosing abnormalities, but it's also a great colon cancer screening test. When polyps are found on colonoscopy, they can be removed immediately so that they never have a chance to become cancer. For this reason, colon screening saves thousands of lives annually. Everyone whose life is saved by the exam is glad that he or she took the prep and had the exam, but few felt this way until the prep and exam were over. The bottom line is that a clean colon leads to the best study and could save your life. Colon preps don't exactly have a reputation for being fun. They are all designed to thoroughly purge the colon of its contents. Everyone's colon is about 6 feet long, regardless of body size, so small people need the same prep as large people. Each person's colon contains quite a bit of stored residue, and multiple trips to the bathroom are required to achieve an optimal cleansing. This can be exhausting. The good news is that colon preps have improved over the years. They have lower volume and better taste. Our prep program has been designed to be the easiest and most thorough prep available, and patients have rated it excellent on convenience, taste, and ease of administration. The program will allow most patients to tolerate the experience without significant distress. Although every patient's experience is different, and it is impossible to predict how your evening will be, there are certain steps you can take and tips you can follow that will minimize possible difficulties. So, I would like to move on to Section 2, the week before your test. There are a few things you need to know about diet and medications in the week before your test. Let's start with medications. If you are on blood thinners, you should listen very carefully. Medications that dramatically thin the blood may increase the risk of bleeding during a colonoscopy. If medically safe, we prefer that certain medications be stopped 1 week prior to your procedure. For some serious medical problems, it is more dangerous to stop blood thinners than it is to stay on them for a colonoscopy. For that reason, you must ask your doctor what to do if you are taking blood thinners. Important medications to stop, if you are allowed, include antiplatelet medications, such as Plavix, also known as clopidogrel, Effiant, and Brilinta. Anticoagulant medications, such as Coumadin, warfarin, Pradaxa, Xarelto, and Eliquis. Very important, check with your prescribing doctor for permission to temporarily stop these Plavix and Coumadin-type medications. If it is not safe to come off of these medications, please contact your GI office. Also note, it is no longer necessary to stop aspirin or nonsteroidal anti-inflammatory medications such as Motrin, Advil, ibuprofen, Aleve, Celebrex, or Naproxen. These medications are not strong enough to increase bleeding problems during a colonoscopy. Again, do not call the office about these medications. You may take them. While I'm at it, all iron-containing vitamins and supplements should also be stopped 1 week prior to your colonoscopy. Iron is hard to remove with a prep and can make the colon look dark. If you make a mistake and take iron, it is not a major problem. You may still have your exam and do not need to call the office about it. In order to help the prep along, it's a good idea to avoid high-residue, fibrous foods the day before the colon prep. That would be 2 days before the exam. The foods to avoid include all fruits and vegetables, and that includes fresh and dried fruit, raisins, fruited yogurt, or any form of fruit. All nuts, seeds, cloves, marmalade. Please note, if you make a mistake and eat one of these foods that I've just listed, simply continue the prep instructions. There is no need to call or be concerned about your study. Your prep may have to work a little harder if you've eaten one of these foods, but there shouldn't be any problem with the prep or the exam. Let's move on to Section 3, the instructions for your prep, the day before your exam. Your prep day is the day before your colonoscopy exam. The overall game plan on that day, which is the day before your test, is to have a light breakfast, as I will instruct, then switch to clear liquids only, then take laxative, use the bathroom multiple times, get some sleep, take a little more laxative in the morning, and come in for the exam. So I'm going to go through each of those steps right now. First, low residue breakfast, then start clear liquid diet. So upon awakening in the morning, the day before your exam, you may have a light, low residue breakfast. Low residue is the same as low fiber. This breakfast may include no more than 2 eggs, prepared any way, or 1 ounce of cheese, and a cup of milk. You may also have 2 slices of white bread or toast, and may have up to a tablespoon of butter or margarine. You may have coffee, tea, or juice and water in unlimited amounts. Please do not substitute or eat more than what I've just told you. You may certainly eat less if you want. After this breakfast, you must start and remain on a strict clear liquid diet. Clear liquids are any liquid you can see through. This includes apple or grape juice, Jell-O, clear broth or bouillon, clear sodas, sports drinks, or powdered lemonade. Sprite, ginger ale, Gatorade, Crystal Light would all be examples. Italian ice or water are certainly fine also. Sports drinks are especially good because they contain electrolytes which help keep you hydrated. Try to drink as much fluid as you can throughout the day before your test. You must strictly avoid milk and dairy products, cream, or non-clear or pulp-containing juices, or anything with a red color. Drinks with red color can mimic the look of blood in the colon. Black coffee without cream or black tea in small amounts with or without sugar is okay. Please drink lots of clear fluid so you stay well hydrated and help to flush out the colon. If you are diabetic, use sugar-free drinks and monitor your blood sugar closely to avoid low blood sugar. If you make a mistake with the above dietary instructions, there is no need to call the office. Again, your prep may have to work a little harder, but you will still be able to have your exam. Next, it is time for the laxatives. On the day prior to your colonoscopy, in the afternoon, we're going to want you to do 2 things. The first thing is to take 2 of the laxatives pills, and the second thing is to mix up your laxative and refrigerate it. So retrieve your laxative bag, and the first thing you want to do is look for the small bisacodyl laxative tablets. They're in the plastic bag, and they're a blister pack. You take that out, and at approximately 3 p.m., take 2 of these. In addition, on the afternoon prior to your colonoscopy exam, you need to mix up the prep. So take out the bottle that looks something like this, and it contains powder prep. I want you to mix that with 64 ounces of Crystal Light or another clear liquid of your choice. So you simply open the bottle, and you want 8 8-ounce glasses of fluid, so you can have 64 ounces of water, and then simply mix the Crystal Light in. There's a little red arrow on the side that you open. And when all that is in, you mix it up, and it's very easy to dissolve. So you've got to have the whole bottle of this in 64 ounces of clear liquid. Again, it can be Gatorade, water, iced tea, or the clear liquid of your choice. So you set that aside and refrigerate it on the day before your exam. And remember, you've taken 2 of these bisacodyl tablets. So you can have that in the refrigerator and then decide what time you want to start taking your prep. And ideally, this is between 3 and 5 p.m., but you can adjust it according to your schedule for that day. When it is time to begin taking the liquid laxative, so if you've decided to take it at 3 o'clock or 5 o'clock, that would be fine. Just keep in mind that the earlier you take it, the less likely you'll be having bowel movements late into the night. So just keep that in mind as you take the prep. When you start out, all you need to do is to drink about 8 ounces of the prep or the powder laxative every 30 minutes until you were finished. The entire solution, this whole container, has to be consumed. The thing is, you don't have to do that very quickly. You can do 8 ounces every 30 to 60 minutes, and you can do it over several hours. If you start to feel a little nauseated, you want to slow it down. So the laxative is tasteless. It should taste like the Crystal Light or the drink that you've mixed it with. The powder in it of itself doesn't have any taste to it. If you feel a little nauseated, as I mentioned, it is probably because you've got a lot of fluid in your stomach, and that's when you want to slow it down so that you will indeed be able to consume the total 64 ounces. So the prep typically starts to work in 1 to 3 hours, but can take longer in some people. Make sure to stay close to the bathroom and use the moist wipes that are provided in the bag, and they are here. Next, we want to move on to the final 2 laxative pills in your blister pack. That's the bisacodyl laxative tablets. You take those after you have finished the drink. So relatively soon after you finish drinking, take the last 2 of these. Continue then to drink plenty of clear liquids, as much as you can tolerate, until it's time for bed. The goal is to develop clear, like water, to yellow, like lemonade, watery bowel movements before your procedure. You may not have clear bowel movements when you go to bed, and that is okay. So now let's move on to section 4. Everything I've talked about so far has happened on the day before your exam, and presumably now you're done with the pitcher of fluid, you're done with all of that. You're now still using these because you're going to the bathroom, you're trying to get some sleep, and you've already taken all of the laxative pills. Let's move on to section 4, your exam day. On this day, you will need to drink the bottle of magnesium citrate that is provided in your bag. And that is the remaining bottle, the liquid magnesium citrate. You need to drink this at least 4 hours before your examination start time, not your arrival time, your start time. Please note, if your examination is early, you may need to set an alarm and waken very early. Pour the mag citrate over ice and drink it through a straw. Stop taking anything by mouth within 4 hours of your procedure. This includes gum, mints, and candy. Taking anything at all by mouth within 4 hours of your procedure time may lead to a delay or cancellation. You may take any morning medications as long as you take them at least 4 hours prior to your procedure. However, if you take a diuretic or a water pill, it is better to simply skip it for the day. Skip the water pill on the exam day. All other blood pressure medications should be taken because we want you to come in with a normal blood pressure. Please arrive at the center at the instructed time, which is usually 30 to 60 minutes before your procedure time. You must also arrange for a driver. If your driver is not with you, he or she must be available by cell phone in order to start your procedure. Your procedure will be canceled if you do not have a ride home. It is okay to take a taxi home if you are accompanied by a responsible adult other than the taxi driver. You may resume a full, normal diet after your procedure, but take it easy the rest of the day. You must not drive, operate machinery, or be responsible for important decisions until the following morning. Now let's move on to section 5, common prep problems and easy solutions. Most individuals will have no ill effects from taking the prep. I am now going to go over some of the more common problems that might occur and give you instructions and advice on how to manage them. Number 1, what can I do to alleviate or prevent a sore bottom during the prep? You should use the included baby wipes and Vaseline to avoid getting a sore bottom. Number 2, what if I make a mistake with my dietary restrictions? Our instructions include avoiding high-fiber foods the day before your prep. It also includes having a small breakfast the morning of your prep day and avoiding drinks with red dye. These instructions are designed to help make it easier for your prep to clean you out. If you make a mistake and eat something not on the list during this time, don't be concerned. Your prep may have to work a little harder, but it will probably work just fine. You do not need to call your doctor to ask if you can still have your test. 2 instructions stand out as extremely important. Take in only clear liquids after your prep breakfast. Eating solid foods later in the day will likely cause a delay or cancellation of your procedure. Do not take anything by mouth at all, including gum, within 4 hours of your procedure. Doing so will definitely delay your procedure. Number 3, what if I feel nauseated? The laxative powder is tasteless, so your prep solution should taste like the drink it's mixed with. Therefore, bad taste should not be a cause of nausea. Some people will get nauseated just because their stomachs can't tolerate the 8 ounces of fluid every 20 minutes. If it helps, you can slow down to a pace of 8 ounces every 30 to 40 minutes or even up to every hour. You must, however, drink the entire 64 ounces and then give it some time to work. The longer it takes to drink the solution, the greater the chance you may lose some sleep having to go to the bathroom in the middle of the night. If you do happen to feel sick to your stomach and or vomit some of the solution, don't be concerned. Just give yourself a rest and continue drinking the remaining solution slowly when you can. You will likely get cleared out just fine. Number 4, what if my bowel movements are not clearing? Well, the goal of the prep is to develop clear to yellow watery bowel movements before the procedure time. For most people, this will occur between midnight and 8 a.m. If your bowel movements do not clear, that is, if they are still brown or contain pieces or flecks of brown material, please call the endoscopy center where you are having your procedure after 7 a.m. and explain the situation. A nurse or doctor will advise you at that time. What if I just can't finish the prep? Fortunately, few people will encounter this problem since this is a relatively tolerable prep. However, if you run into a brick wall with a prep for any reason and just can't go on, there is no need to call in the middle of the night. You may call the endoscopy center or hospital in the morning to notify your doctor about the problem. Only you will be able to decide whether you can finish the prep. Occasionally, a patient will develop clear bowel movements without finishing all of the prep, or without taking the clear fluid, which is the magnesium citrate. Once you are sure that multiple bowel movements are clear yellow or clear like water, you are done. If you give up on the prep in the late evening or overnight, you should not eat solid food because you may find that your bowel movements eventually clear. If you do eat solid food after giving up on a prep, there will be no way to have your test. Call the endoscopy center in the morning for advice if you have not been able to drink your entire prep and if you are not sure whether you are clear. Once again, it is not necessary to call the doctor or office in the middle of the night to notify us that you cannot take any more of the prep. If you cannot take any more, do not eat solid food and call in the morning. What if I begin feeling extremely ill or have an emergency? Although many patients feel mildly weak, tired, bloated, or nauseated for a brief period during the prep, it is rare and abnormal to feel extremely ill for a prolonged period of time. If you have chest pain, trouble breathing, fainting, or feel extremely ill in any way, you should proceed immediately to an emergency room. If you have any known chronic illnesses, such as diabetes or heart or lung disease, you should be particularly wary and do not delay in getting to an emergency room if you feel extremely ill. All diabetic patients must monitor their blood sugar levels throughout the prep process, especially if feeling lightheaded or ill. Immediate treatment for low blood sugar readings is critical. What if I forget and take a blood thinner the week before the colonoscopy? If your doctor gave you permission to stop taking Plavix or Coumadin-type medications, but you make a mistake and take it within a week of your colonoscopy, it is best to give your GI doctor a call for advice and direction during the day or the next morning. Remember, it is fine to continue taking aspirin and other anti-inflammatory drugs during the week of your colonoscopy. This is a change from instructions given in the past. Are there any other preps that would be easier? Our prep program is designed to be the easiest and most effective prep regimen available. Over 90% of patients rate it as excellent or good, and many people comment on the convenience, tolerable taste, and ease of administration. All preps require drinking at least 64 ounces of fluid, including the so-called pill prep. Is there a colon exam that does not require a prep? All studies that look at the inside of the whole colon require a cleansing prep. There are studies that do not visualize the entire colon or don't visualize the colon at all, but these studies are more limited in their sensitivity and usefulness. If you are receiving a colonoscopy for a bowel problem, there is no substitute for a colonoscopy with a prep. If you are being screened for colon cancer, there are some less sensitive screening tests that don't require a prep, but they are limited in sensitivity and miss cancers more frequently. That's it. It may seem complicated at first, but it's really fairly simple. And remember, a clean colon could save your life. We wish you the best of health in the future. If you have any further questions, do not hesitate to contact the office at 302-225-2380.